Sydney, it's Jenny and Lloyd. And Lloyd, say hi to Sydney.
Hi.
See his pillow? He uses a towel or the bucky upside down like a horseshoe. He is going to tell you how to do your own eyes. He will be working on his left eye and turning his head toward you, which you will not do. And he also wants to show you how to prepare the Q-tip. Go ahead, Lloyd.
Okay. There's two precautions Paul talks about. One is you got to take your contacts out. You don't do this thing with your contacts in. The second one is he likes you to hold when he's doing a client. He'll hold the Q-tip like this.
Bring it down towards your chin to show us.
He'll hold the Q-tip like this. That's not possible to do on yourself, nor is it necessary because you're not going to apply too much pressure on your own eye, and this will flip out when he's doing a client. So you can hold it as a pencil grip.
Show us right down by your chin. The
pencil grip. Or right
Perfect.
There. A pencil grip.
Perfect.
Because you're going to control your own pressure. There are 8 spots to do on the eye. First will be the medial section.
I'm going to come up and actually come right over you. What do you think?
And we'll make a little drawing maybe at the end to show you what we've actually done. And that's probably the best way. This would be like 3 o'clock. Or
so you're gonna move.
Okay.
There you go.
And there's a little ligament that holds the eye in place. So the muscle, you have to hit this muscle, this internal muscle, from the top. So
you see, Sydney, he's going on the eyelid. He's not on the eyeball. He's between in the lid crease.
Right. Now, Paul likes to twist the Q-tip counterclockwise to get it a little deeper. I never do it personally, but it works better if you do it that way. You want to twist it into the eyelid.
Lloyd, it would be helpful if you could hold the Q-tip up a little higher. Your fingers are hiding the... That's great.
Oh, yeah, the old pinky. I like the old pinky method. But yeah, you can hold it... yeah. And what you would do is just rub it one way. You rub it down and up. And you can do a little sideways. And you can do that sort of internal rotation into the eyelid. And it should sting a little bit. Slight sting. You've had work done by Paul. You know, you have a vague notion. The eye is very gentle, and do it until it stings, and then stop, and then we're going to do the superior muscle. That's at a 90 degrees. And it's the same method. You sort of rub it cross fiber.
You see how his eyeball pops out there and see how deeply he is? You're going to want to go gentler at first.
Gentle at first.
So he feels, but see, he's in between the crease. So come out and show her where you are again.
Right, so
go in slowly.
Okay, directly 9. Well,
there you go.
12 o'clock.
Perfect.
And then you do that little twist. You do that little twist, and that opens the eyelid a little bit more. And it goes a little deep. Now, of course, you look down. That also stretches the muscle so you can get it better. So you look down...
When you do that superior muscle.
When you're doing the medial muscle, you want to look to the side. And you'll feel a little more tension on the muscle as you stretch it. It's all by feel.
The third one is?
The third one is the external. And that also has the tendon or is a ligament to hold the eye in.
So for clarity purposes, turn your head slightly towards me, and then grab the Q-tip just a little higher so I can see it. Okay, let me see if I can get that.
Right.
So see, he's on the external portion once again in the eyelid crease.
All right, so you have to push down a little bit.
Okay, number 4.
Now number 4 is the oblique. There's a fourth little muscle here, and it's halfway between the two muscles, and you'll feel it. So you'll palpate it, and you'll dig in right there, and I can feel it right there. And then to really feel it, you look down across the body, and that will stretch out that oblique.
So see, he's looking sort of cross-eyed over at his nose.
And I can feel the go right.
We
right
do our
across
eyes all the time, Sydney.
Should do them every day. I don't. I do them every month, but I should do them every day. It's delightful. It takes a minute.
Okay, and the next one?
Okay, so that's the top portion. Then we're starting the internal again, or the medial.
Mm-hmm.
And you have to push up slightly in there. It's the same muscle as the other external. It's just that it's protected by this.
You're never touching the eyeball. You see, he's on the under crease.
Yeah, it's all the eyelid. Yeah.
And number 6 is?
Well, number 6 is the inferior, 6 o'clock.
Open up your eyeball so we can see it. See how his...
And then I look up, and obviously you look up to stretch out the muscle. And that feels real good. And you can twirl it as well. Twirl it into the eyelid.
And 7?
And 7 would be the external again, the lower portion of the external.
Mm-hmm.
And you go in there.
Show us a little more of the Q-tip. I know it's not the right... See, he's
Right.
holding it correctly.
I'm holding it right up here. But
Right,
yeah,
you-
you can try that.
Well, it's just for her to see.
All right.
This is hard to film, you know. That's great.
So that's the 7th one.
Mm-hmm.
And I'm trying to look that way, and that just stings right there. So just remembering to do that.
Stretching it. So it's like a pin and a stretch.
Pin in the stretch.
Pin stretch of the eye muscles.
That's good. Then you can do a little motion, but the pin in the stretch is good. And then the 8th one is the other oblique, and that's between it's an outer portion. It's in between the medial and the external. And you can feel it. It's right there on me.
We'll send you a muscle chart.
And for this one, you will look up for it. Up and over. So up and medial.
Beautiful.
And that's
So
the
you
other
want to
one.
go careful. See how he digs in?
I dig in.
He's been doing this for 20 years.
But they have to be very gentle. They don't want to get sued.
He's talking about Paul and Randy
they
and
all
them,
do
but
it much too gently to.
you can really affect the eyes. So this is just starters. Lots of questions. Thank you, Lloyd.
And then you have a right eye, so do the right eye as well.
Goodbye, Sydney.